Okay, we've been sent a case for evaluation today. This is a patient Edentulous at site number 19, it looks like, and we want to go ahead and review this plan and get a more ideal plan if it's not ideal already, and go from there. This is honestly the typical case that we see in most general practices, and I believe should be in the wheelhouse of most general dentists. More than likely, this case can be done with a punch and can be done quite predictably and efficiently. So again, with a surgical guide, our options here, since we're able to properly bring in the CEREC data, our options are OptiGuide, DigiGuide, CEREC Guide. I would say that this is a great case for any of those guides, OptiGuide, DigiGuide, or CEREC Guide 2. So let's go ahead and begin and take a look at our overall game plan. So this is one that we will go with my implant planning checklist, and I'll walk us through that. So mesiodistally, what I'm again evaluating is, do I have enough space between the roots, and am I pretty well centered? What I would like to do actually is go backwards one step here and start with anytime I plan a implant, I'm going to start with my ideal size implant and then work backwards based on clinical situations. So in this particular case, I would make this a 5.0 by 11.5 millimeter implant. Now that, again, that doesn't mean that's where I'm going to end up. It just means that's my starting point. I always start ideal and see what would prevent me from being able to do that. Okay, so now back again, mesiodistally, we look pretty good. What I would say in looking at this mesiodistally is that we, restoratively, if we look at our spacing from here to here, compared to our spacing from there to there, we have more space here on the mesial of this, so we can see that we're a little off there. So more than likely I would just go ahead and let me undo that, and we can also see as we look closer here that we're not lined up with that buccal groove, and assuming that's designed in the right space. So I'd go ahead and probably move this over just a hair like so I can get it pretty well centered, mesiodistally as well there. Okay, now buccolingually, what I'm seeing here is that here, number one, is the outline of our bone, just like so. And here we can see that we're relatively well centered in the ridge. We can see that we've had some bone loss here on the buccal, very typical atrophy there. And hence, that's why if we take a look at this in the restorative perspective, we are definitely lingual to the tooth. And I know why we did that, because ideally we'd probably do it right here, but now we can see that we're going to be outside of the bone. So to me, this is where tipping comes in play. So now I would consider go ahead and tipping this implant a little bit this way and a little bit that way, and voila, suddenly we're going to get a little bit better in this spot here, just like so, and still plenty in the bone there. So something along those lines there would be a little bit more ideal, centered buccolingually, sorry. And then you can also see here now we're getting close to the central groove, and we can see again in the 3D view here that we're starting to get a little bit more centrally located. So just to give you an idea, comparison, here is the 3D view of the original plan. You can see where we're at on the 3D view. Our access is coming lingual and slightly distal, whereas we've made a few tweaks and now we are coming a little bit more centrally here. The one negative of my plan as I have it, because of the bone loss that we've had on the buccal, is my implant is tipped slightly straight up and down or to the buccal, and ideally I'd like this implant to be straight up and down or slightly tipped lingually, but we cannot do that in this case without having to consider doing something like this. Would be probably a little bit more ideal implant position, but that would require some grafting to be done here, and many of us aren't comfortable with that, so that's totally okay. So in this particular case, so and then our next step would be to look at bone level. I think bone level going slightly subcrestal right here is totally fine. What we may have to do when we place the implant, we may have to use a bone profiler and just slightly adjust the bone right here so that we get a good bone emergence, so that we can get our parts and pieces and abutments seated to properly control that. Next would be our vital structures, and here we can see this is where we have to look for the mental foramen, sorry, the inferior nerve, and we can see it here. And there's a potential chance that we're getting a little close right here. So why not go to a 10 millimeter implant? We know that 10 is more than adequate enough. So why even take that risk in this particular area? So let us go ahead and leave it just like so. Okay. Next would be occlusal table, and here we're in the occlusal table in the axial view. We can see that we're pretty well centered, so that we're going to have a good support for our restoration. And then our occlusal plane, here what I'm looking for is my occlusal plane look pretty level? And again, it does. If I were to be slightly hypercritical, I could say that maybe it should be a little hair flatter like so, and then just slide that over just like that. So, if I were to be slightly critical there, I would say that. But then I would say also our emergence profile may not support that as well. So maybe we should just go ahead and have our occlusal plane slightly off, but have good emergence there. So last thing, we'll bring our sleeve in to make sure that our sleeve does fit. We'll use since it's a Nobel implant, we'll use a Nobel sleeve. We click OK, and we can see that that sleeve fits well. The other nice thing about the sleeve is it's a great way to see how well you're centered, and I like to see my sleeve totally within my restoration on molars, and we can see that we are achieving that here. So zero issue with that as well. And so basically everything looks very good. Last thing, we'll do our 360, which we've kind of done along the way, just to make sure there's no surprises or sudden changes, and everything looks good. So these are minor adjustments to the plan, again, just to kind of give us a comparison of this plan versus the plan that was sent in. Let's go back to the original plan, and we can see here some minor changes right there. And then we take a look at the adjusted plan, and we can see some minor changes there as well. So thank you very much, and hopefully you found this very helpful.